Let's talk about leave of absence letters. Particularly, Headway put out a template for you to use for leave of absence letters with your clients, but there are some problems with it, and I want to cover why we need to look at leave of absence letters in our practices. Any letter that you write for work or for school is part of clinical documentation. Okay, that is going to be part of the file, and it can be subpoenaed, and it can show up in an HR dispute and an ADA request and a board complaint, and it could be a reason that you could get called into court. Now, do we avoid doing things just so we don't go to court? No, because that is part of our job. We will get subpoenaed at some point. See my other TikTok on court policy. But it comes down to expertise and the ability to do these kinds of letters. Are you a person who is trained in assessing fitness of duty or ability to work? And does your documentation back up what you are saying in your letter? Because whatever template you use, you're on the hook, not some cute template from a corporation who probably doesn't have your best interest at heart. First of all, you're not required to write these letters at all, and you need to stay within your scope of practice and competence. That's really important, and anything that you put in writing must be specific, factual, and supported by your documentation. Being vague with your clinical considerations, which is what Headway recommends, it's not enough. It's sloppy, and that's actually more risky. It needs to be very, very clear and factual. So before you write any letter, you need to ask, what is this letter actually being used for? Am I the right person to make this determination? If I were called into court or an HR dispute, could I justify this letter? Do I have consent to write this letter? And do my notes and training support what I am writing in this letter? Headway's article was written by an associate therapist, and it had the recommendation of being just really vague in your letter. But the truth is that whatever we write has to be justified by documentation. So vague doesn't fly here. And if you aren't sure if something is within your scope, consult. It's probably not in your scope. We are usually pretty clear based on our training and our expertise what we are trained to help with. And if you aren't sure, then get consultation before you do one of these letters. And don't use a template from Headway. Just don't.